Hello, doctors. Dr. Robbie Wyatt, Chief Clinical Officer for Ergo-Flex Technologies, and I'm going to talk to you about a specific question I have been getting repeatedly for the Back On Trac, and that's whether or not it's safe to put a patient on the Back On Trac system with a spinal fusion. I'm going to talk about neck and I'm going to talk about low back. The answer is yes, it is safe to put them on the Back On Trac as long as you have stable segments. So you may need to do a motion study, either lateral bending or flexion extension, to make sure that we don't have a real bad unstable joint either above or below the fusion itself. As you know, when we fuse the spine, lock out that movement has to go somewhere, and it goes typically to the segments above and or below that fusion. So if you get a fusion at L3, 4, and L4 and L5 are not fused, they're going to pick up a tremendous amount of extra motion and strain. So the other factor is we want to make sure that that fusion is at least a year old. All right, we're not going to create any problems with the hardware itself and those fused segments. The question is do they have a hidden problem such as infection? Okay, when we put implants into the human body, they harbor bacteria. This is one of the hardest things in relation to any type of spinal fusion. That hardware implant just attracts bacteria. I have quite a bit of experience, not only from a clinical standpoint, but from a personal standpoint. My brother, my father, and my mother all have fusions. My mother's on her third fusion, and she's fused from L2, 3, 4, 5, and S1. And I have kept her going with decompression, and when I found the Back On Trac system, it improved her outcomes significantly, specifically because of the lateral flexion. Okay, that lateral flexion with traction is an amazing event for the lower back. Now, when we lock down spinal motion, we're shutting down the cerebral spinal fluid pump. Okay, 90+% of the nutrition comes from movement of the spine. That for the brain itself. So 90+% of the nutrition to the brain comes from movement of the spine. Now think about that. If we shut down movement anywhere in the spine, whether it be through subluxation, fixation, or fusion, we are shutting down that cerebral spinal fluid pump. So think of the Back On Trac system as CPR for the brain. Okay, it's going to pump that cerebral spinal fluid. It's going to move it all the way up and down that spine. All right, so critical that if you have somebody that's got a spinal fusion, even if they're in pretty good shape, they're not having a lot of symptoms, which is a rare event, they definitely need to be on the Back On Trac. Now, when it comes to cervical, so right now we are recommending the Mod Pod and or the Saunders unit. Those are fantastic. They do a good job. The problem is anytime you do axial traction in the cervical spine, you straighten out the spine, you lose the cervical curve, and that has its own issues. You may have increased the disc height or shut down that dysfunction when it comes to compression, but now you have a whole nother set of events. So things like dental roll, you definitely want to be using curve restoration techniques in conjunction with straight axial cervical traction. Okay. Now, I'm currently working with JT on a curve restoration traction program and addition to the Back On Trac. It's going to be coming out here in the near future. We're still working on all the kinks, but so far it looks amazing, and it's really doing a good job. So, but going back to the question, is it safe to put spinal fusion on the Back On Trac? Absolutely. We want to make sure that that is a stable fusion that's at least a year old, no active infections, and certainly no active cancers. All right. So Any other questions, docs? You can reach out to me at dr.wyatt@backontrac.com.